I'm still trying to reconnect, ladies. I'm sorry. All right, so we're gonna be able to go live now. That was kind of like weird and scary, but okay. All right. I'll- oh my God, I think we are or were. No, we are live now, actually. Hi, everyone. Welcome to another episode of Campbell Talk. And today we have Jenn and Alisha on, and they are going to be talking to us today about testing, the importance of testing, and some other biomedical interventions. So, we're going to be talking about PrEP and HIV treatments and what's out there, what's available to you. So grab your girlfriend, grab your boyfriends, grab all of them, and come on in. Come and have a seat. If you are watching this, please get your questions ready so you can ask them in the live, and we'll try to get them answered on air. Um, if you know someone who is living with HIV, someone who's not living with HIV, someone who you work with, someone who goes to school with you, someone who live on your block, who call them up, let them know to log on, because we got some good information for them today, like we always do every Monday. Duh. So just get everyone on, and come prepared. We have two beautiful ladies here who are going to blow your mind with tons of information, and we have it all. We have it all. We have it all. You're going to learn so much. So please like and share. Like and share. Somebody out there in your timeline need to hear this information. So if you are on, thanks to my folks who are watching right now, please like and share, and invite folks to watch. And I'll be right back, and you'll be able to meet Alisha and Jenn, and we'll go from there. Welcome.
Thank you.
Hi, Ricciardo.
Thank you for being on the show today. All right. So I'm just gonna turn it over to you and say, okay, fine. Introduce yourself. Tell us who you are, where you went to school, where you work at, and all that good stuff. And so we can get our viewers to know you, and then we'll jump right in.
Jenn, you want to go first?
Sure, you can go. It's okay.
Okay. Hi, everyone. My name is Alisha Azemar, and I am a nurse practitioner. And I started working in infectious disease, primarily HIV and HIV prevention, in 2016. I initially started with the health department and really grew to love the field. It gave me a lot of satisfaction as a new grad to see people getting well, getting into care, and getting better. Um, as a nurse on the floor, unfortunately, I was taking care of a lot of people who were ill, obviously hospitalized for one condition or another. So it was great to be in a setting of a clinic where every time you saw someone, you were seeing them get better. And not advancing in illness. I went to school at Chamberlain University. I did my master's and my doctor of nursing practice with them. Great program, great experience. And I left the health department sometime last year and joined Midway Specialty Care Center here in West Palm Beach, Florida. And that enabled me to finish my doctorate. And now I'm looking more towards not just hands on patient care, but hopefully doing a little more research. So that's pretty much me in a nutshell.
Thank you. Jenn?
Hi, everybody. My name is Jenn Koretzky. I'm also a nurse practitioner. I also work at Midway Specialty Care here in West Palm Beach. I started as a nurse practitioner in 2009. I went to the University of Miami for my master's and my doctorate in nursing. And while I was in my rotations at the University of Miami for my master's program, I was placed in a clinic with Dr. Arnold Oper, who was treating persons with HIV in South Miami. And I fell in love with helping people get better, addressing the social determinants of health, breaking down the stigma, and then the rest of infectious disease just kind of came along with it. I completed my Doctor of Nursing practice back in 2011, and I've just always wanted to give back to the community. During my time as a nurse practitioner, I've also served as a sub-investigator on multiple clinical trials for many of the medications that we use today, thank goodness. And I also serve as the Associate Dean for the Master's and Doctoral programs at the School of Nursing at Palm Beach Atlantic University here in West Palm Beach as well. Thanks for having me, Richardo.
Thank you. Thank you for being on. And I love having both of you on because, as you know, we've kind of like gone through a wide spectrum of topics, and we've talked about testing. We've talked about how race and ethnicity and socioeconomic status have impacted HIV prevention efforts, and we've talked about what folks can do on the local level to kind of like not to avoid acquiring HIV, and also to kind of like live longer, healthier lives if they're living with HIV. And the list goes on and on. So we've had over 20 something guests on the show already, and we talked about a wide variety of different things, including entrepreneurs who are just like talking about how they're creating social impacts. So a lot of this will tie into how do we create social impacts for community? And that's going to be one of your questions towards the end, right? Is how all of what you do is creating social impacts for the communities you serve, for the communities you live in, for the communities that you work in and through. So I'll toss my first question out there to you guys. So, why is it important for people to get tested? Um, in all my talks, everyone know that I'm particularly focused on Black and Brown communities, which represents the highest rates of HIV and STDs and everything you can say at this point, COVID, everything. So, why is it important for people to get tested for HIV? Jen, go.
Oh, sorry. All of a sudden, it's okay. All of a sudden, my computer wanted to do an update. No, not right now. Sorry. So it's really important for people to get tested, because what we know about HIV is that if you get on treatment, if you have HIV and you get on treatment, you can live a long, healthy life. You can live, I tell my patients all the time, you can live to be however old you are supposed to be, provided that you also take care of yourself. So that you also exercise, that you eat well, don't smoke, don't drink, all the things that we tell everybody in the world. But if you don't know your status, then we can't get you on treatment. And then the flip side is if you don't know your status, then maybe you would be somebody who should consider HIV prevention, like PrEP. And you should have that conversation with your provider. And you can only know that if you know what your status is, and you know whether or not you have HIV, or if perhaps you should consider prevention methods like PrEP.
Okay. Alisha?
So just to piggyback on what Jen said, you don't know what you don't know. So unless you're getting tested, you don't know your status. You don't know whether or not you're positive, and you don't know whether or not you should be on treatment, or if it's just adequate for you to be on PrEP. Part of being on PrEP, which is preventing exposure, okay, to HIV transmission, is that we do an HIV test, because the medications that are given to prevent HIV are part of HIV regimens. But if they're just given by themselves to someone who is positive, we can actually do more harm than good there. So to test and to screen for HIV is very important. We don't know if we have high blood pressure if we're not screening for high blood pressure, if we're not going to the doctor and getting those blood pressure checks, or going to the pharmacies and sitting in that machine. I don't know how many are left in the stores because it seems like they've been pulling them out of the stores now.
Mhm.
Diabetes screenings are important, just like cholesterol screenings. We can't treat these things if we're not being screened for them. So it's key. It's very important to do that as you would routine health maintenance, depending on your lifestyle.
Awesome. Now, I know you mentioned like routine testing and stuff like that. Like you mentioned diabetes just now. So historically, we know that Black and Brown people are less likely to go see a provider, for number of different reasons: lack of insurance, lack of resources, lack of transportation, and the list goes on and on. So, how do we make, or what recommendations would you have or recommend for us to be able to engage people around accessing preventative medicine or preventative care before it's too late?
I think a lot of it has to come with trust. And I'm hearing now that HIV testing is happening now in churches
Mm,
and social gatherings, which is a huge deal. If you are in an area, in a community that you trust those around you and you're comfortable, you feel a sense of community and you're more likely to go and get tested in your community. Uh, in the Black community, there is a lot of mistrust. And sometimes you hear people say, well, every time I go to the doctor, he or she finds something. And part of that is because they're afraid, there's fear. And so, to help encourage testing, you kind of have to promote an environment where it's safe, people feel a sense of belonging, and that kind of helps encourage more people to come forward and screen.
thank you. Jen, would you like to jump in on that one?
Yeah, I would agree with Alisha on that. I think that we have to take opportunities to get preventative screenings, whether it's getting your blood pressure checked, getting your blood sugar checked, getting your rapid HIV test, a rapid hepatitis C test, in all kinds of settings. It can be in a church, it can be in a community park, it can be lots of different places. It could be just the back to school bash like next week, right? Um, Take that opportunity to just do it. And then you can follow up with a provider after that for further follow up. But I think we have to continue to encourage those types of opportunities. Again, like Alisha said, in places where people trust the other people around. And that's really important.
Okay. Do you find it challenging to have conversations with your clients around the importance of knowing and taking care of themselves, and also kind of like that cultural piece, right? And do you find it very challenging to have those conversations?
Sure. I think at first, but once we establish a trusting relationship with our patients, it gets to be a lot easier. And I have very frank conversations with my patients, and I say, look, I realize your skin color may be different than mine, but understand that through our education and training, I've learned about some differences that just make you different and help me to understand how you specifically as an individual are different. Not say, oh, my patient's not compliant. I hate that. It's what is keeping you out of care, right?
Right.
It could be that it's grandma who's providing care for multiple grandchildren,
Yeah.
bringing them to and from school. And then you say, well, she never makes her appointments. No, her priority is her family, right? And that's a value. And so, yeah, we have education and training, like I shared, and I'm very upfront with my patients about that. But we also have to seek what is important in our patient's perspective to help meet them halfway.
Okay. Awesome. Alicia, did you have any?
I think being frank and honest with your patients makes a big difference. I really try to make an effort to kind of feel for the type of person I'm dealing with. Some patients, you have to coddle a little bit depending on the situation and what's going on. And you can kind of determine how sensitive you need to be. Whereas there's other patients who just come up to me and say, Alisha, give it to me straight. Don't sugarcoat. I need to know. And, I really appreciate that because it kind of helps me gauge what I can and cannot say. And so that's very important. Um, and what Jen referred to as far as barriers to accessing care, I think it's very important for us as providers not to be quick to judge and just automatically assume a person is being irresponsible and doesn't care about their health. I try to reiterate to my patients, you can do whatever you need to do, but you need to be in a position where you're healthy enough to do it. You want to be able to provide and take care of your family and help this person, help watch the kids and be able to, you know, provide certain things for people. But if you're not in a position where you can physically do that, where you're not healthy enough to do that, that will get in the way of all of that. So it's very important that we keep those lines of communication open and kind of speak openly with them.
Okay. Now, earlier, I think you mentioned prep, and of course, this can be for anyone. So, can you walk us through basically what does prep mean?
So I really like Jen's explanation of prep, so I'm going to leave that to Jen.
Okay.
Are you talking about my relationship to birth control? That one? Yeah. So I tell people, so PrEP, pre-exposure prophylaxis, it is an HIV prevention measure. And PrEP kind of got coined when we started to have tablets that somebody could take one tablet a day to prevent HIV. And so I often tell people it's similar to taking the birth control pill. You have to take it for a while for it to start working. And if you stop taking it, it doesn't work, right? So very similar. And thankfully, you can take a pill every day to prevent HIV. You can take a pill every day to prevent pregnancy. Also, now more recently, there is an injectable that we can use to prevent HIV. It's an injection every 8 weeks that somebody can receive from a healthcare provider, and it also prevents HIV, but there's no more pills to take. So it's following very similar to what we have seen in birth control for a long time, where now there's options for people. You can prevent pregnancy, you can prevent HIV. Both things. And again, it's only as good as if you take it or if you get that injection, right? If you don't get it, it stops working.
Okay. Ladies and gentlemen, you're hearing that. You're hearing that live right now, that there is an injectable that is out there. It's available. So if you are a person who don't like taking medication, don't like taking pills, you barely can survive with taking vitamins for a week, there's an option for that. Or there's an app for that, but there's an option for that, and that's basically a pill. So do you how does I mean a shot, sorry, it's one shot once every other month. So how does this, so like someone comes in and they say, "Look, I want to take the shot for prep." What how does that work? How many shots they have to take? Like do they have to take um is there like a waiting period? Like how does it work?
Sure. So when somebody wants to get started on our injectable PrEP, a lot of times the first thing that will happen is you'll get baseline STI, STD testing, and an HIV test. Once we know that's negative, a lot of times we put somebody on the pill version of the injection first to make sure that it's tolerated okay, that the person doesn't have any side effects. You take that pill, it's one pill once a day for the injectable prep, with the bridge to injectable prep is what we call it. So you take it one pill once a day for up to 30 days. And sometime in that latter part of the 30 days, you come into the office for an injection by a healthcare provider. So it's a shot that's given. You would get it that day after, again, taking the pill version of the medication for a few weeks. And then you would come in again 4 weeks later to get the next injection. And then every time thereafter, it's an injection every 8 weeks or every other month. When you come into the clinic for the injection, we also still do labs, much like people who are on oral prep, who take the tablet version of HIV prevention or prep. We do labs when they come to the clinic. It's similar when we do the injections.
Okay. Ooh, that just makes everything a lot more easier, I think.
Yeah.
So, have you been seeing like people are gravitating towards more of the shot because it just makes life easier, or people are still kind of like wanting more information?
I think there's a fair amount of people that are seeking injectable prep, but there's still a lot of people that are totally fine with taking a pill every day. So I expect that for the individuals maybe that didn't want to take a pill every day, we'll eventually start to see them coming into care, because for the people who were taking a pill every day, they've been okay with it, right? And cool, now they have another option, but this is going to help us to reach even more people who maybe didn't want to do prep before, didn't want to take prep before because they didn't want to take a pill every day.
It sounds like people are like creatures of habits, right? And we know you are out there. Ray and them is out there. We just need y'all to just really listen. Prep isn't right for prep is not for everybody, but
Correct.
everybody should know if prep is the right option for them. Is that just call and talk to someone and figure this out. So, if you're just joining us, you're watching Campbell Talk, and we're on with Alisha and Jenn, and they are from Midway Specialty Care Centers uh, here in Palm Beach County, and we're talking about testing and prep right now, and I'm sure we're going to go into some other questions later. Um, so right now, we just finished talking about the fact that there is an injectable out there for PrEP. So in case you don't know, you would take PrEP to prevent you from getting HIV. It used to be in a pill format where you take a pill every day, sort of like the birth control for HIV. And now there is another option where you get a shot every other month. So this way you don't have to take pills every day. Ta-da. So, but to know if it's the right option for you, you have to go in and talk to either Jen or Alicia or another team member. So this way you can kind of like figure out what's the best option for you. So we're gonna take this time right now to tell people like where you guys are located, how they can find you, and all that good stuff.
Sounds good.
Alisha, you want to go first?
Okay. So, well, we have an office in West Palm Beach, and it is located right next to Good Samaritan Hospital. Beautiful on the intercoastal. And the address for that one is 1515 North Flagler Drive. And we're in Suite 200, West Palm Beach, Florida, 33401. And we just opened up a second location in Atlantis, right next to JFK, Maine. And that one, now I'm trying to remember the exact address. Any other time I would remember this address. It is 5507 South Congress Avenue, Suite 150, Atlantis, Florida, 33462. And I am personally over there on Tuesdays and Fridays.
Yeah, and I will add too that at our West Palm Beach location, we do offer evening and Saturday hours. So we understand the working world, as we are definitely a part of it. And so we do offer some evening and Saturday hours. We also, at our West Palm location, do offer walk-in STI testing. So maybe you realize you had a little bit of extra time, you got out of work early one day, and you're like, you know what, I heard I need to know my status, I need to get tested. I don't even know the last time I had an STI test, right? We do offer, if you're not having any symptoms, you can just walk right in, and we can facilitate that, because we really encourage people to get tested and to know their status.
Okay. We have a question. If someone is on prep and they miss a few days, how long can you go before losing protection?
That's a good question. So I'm assuming we're talking about the oral prep, since that would probably be what's missed. So we know that you need to take prep most days of the week in order for it to be effective. That being said, with each day that you are not taking prep, so let's say, for example, you took it yesterday, Sunday, and you didn't take it today and then tomorrow, with each day, the drug levels of HIV, the HIV prevention pill, falls. And so we don't know exactly when that would reach a point with you specifically, when that would stop working for you, but know that that drug level is falling. And just like the birth control pill, the efficacy stops, it slows down, and it really minimizes its effects. Each day that passes that you don't take it, that same thing happens with HIV prevention too.
Okay. Thank you for that question to our viewers. Please continue to like and share if you're watching. You can follow us, encourage folks to follow us at Campbell Health Solutions, on all of our Facebook and Facebook, Instagram, TikTok, podcasts, YouTube, and LinkedIn. You can find us all over the place. You can follow us there. How do you find that there are any challenges with working with clients who speak different languages, in terms of, speak different languages, different dialects, different, uh, just adjusting to this preventative education, testing, treatment? Do you find that how do you find that, like, what resources are available? So if someone is watching this and, si habla español, parle francais, am I saying that right?
You are.
Are there resources that you have for people who speak Spanish or speak Creole or any other languages?
So,
Yeah. Oh, sorry, Alisha, go ahead.
no, I was going to say, as you know, Richarda, we are in South Florida, and in South Florida, we are highly populated with people who predominantly speak Spanish and Creole. And so at our particular location clinic, we're very fortunate to have personnel who speak both. And that helps a lot because, you know, cultural background plays a lot into, again, comfort. And so people identify with being able to come and seek care, whether it be for prevention or treatment, where they can kind of relate. And so we are fortunate enough to have people who speak those languages. At Midway on our website, our new patient packets are actually available in Spanish as well as Creole. So that helps. So we make an effort to really communicate with patients coming in. Sometimes it can be challenging if there's another language, but we have ways to have interpretation done so that we can communicate with patients who speak other languages. So we've been fortunate, and it hasn't prevented us or created a barrier in us being able to extend our services.
Okay. So now you have, and we're going to switch gears a little bit and talk about HIV, because now you have, people who are newly diagnosed living with HIV, and some of them are afraid of coming in and seeing a provider because they're like, oh, all this medication, you know. And folks, it's not like it used to be back in the 80s, the early 90s, even the early 2000s. The drug treatment have gotten much, much better, right? But there are still folks out there who have a fear, because they come in and they're like, oh, I don't want to take like 10 different medication and all of that. So if somebody is out there and they're kind of like on the fence right now about whether or not they should start taking medication or they should come back in and re-engage in care, um, what would you be able to tell them about where we are with treatment now that would help them to kind of like say, you know what, this might be my time?
So I'll share with you. I think the first thing that people should know is that for most individuals, you can be started on one pill once a day. So yeah, the cocktails of the 80s and the 90s are no more. Um, but I think more importantly too, seek care and tell the provider about what makes you you and what's important to you. Because we have so many regimens, we have choices these days, of regimens of medications that we can put people on. So tell us what matters to you, and then we'll work with you to figure out a regimen that will help you to stay healthy. And I think that's really the approach. We couldn't say that 10 years ago. We only had certain options, and 20 years ago and 25 years ago. But now we're to the point, you tell us what you need in a medication, and we can probably find something that works for you.
Awesome. Alicia, any thoughts you would like to share on that?
Yeah, I love to tell patients when there was a time where it was a huge amount of pills, when people had to take like 8 pills 3 times a day, and how we've come such a long way now that we're down to 1 pill once a day. And it really amazes people, and we're so fortunate to be in this time, in this day and age, where advances have come along, where we're able to manage and bring people down to a viral load that's undetectable. And U equals U now. I mean, it's huge. We never talked about U equal U before. Undetectable equals untransmittable. And now that that's even such a conversation, it's so exciting and rewarding. And I know Jenn can identify with this because, just a few years ago we hadn't even heard that phrase. And so to be able to be a part of it, it's really a big deal. And patients really appreciate a little bit of that history when I tell them that.
That's truly amazing. So, like PrEP, I heard there is a shot for HIV. So, is it kind of like the same thing, or like, is it the same way or similar to how the PrEP shot is administered? And keep in mind, folks, we are now talking about like HIV and the treatments for HIV. Okay, so if you have questions, make sure you ask them. We're bringing you experts, y'all. We're bringing you people who know what they're talking about. They went to school, they learned a bunch of stuff, and now they're ready to share that with you to help you to be safe, to help you to protect yourself, help you to protect your loved ones and your community. So, is it the same as like the PrEP?
Alisha, do you want to talk about this one?
Sure. So it's similar in that there is an oral lead-in, and some providers will choose to start with that by mouth oral lead-in form for 30 days, and some do not. But prior to starting to the oral lead-in, the person has to already be undetectable for at least 6 months on their current HIV regimen. And once they are, we can start the oral lead in or go right into the injectable. And for the first injection, you give that, and then there is a window where they take the injection um, every 28 days for the first two injections. And there's that 7 day period where if they are 7 days ahead of when it's due or 7 days after when it's due, it's okay, as long as they get it within that 7 day period. Unfortunately, if they happen to miss it, if for some reason they went out of town, or something came up and they weren't able to make it within the 7 day window when that next injection was due, the process kind of starts again. But as long as they're getting the injection, they're able to come in. Then we go on to the next month, the next 28 days, which is month two. And once you're all set there, then you can move to every 2 months. The main difference between the PrEP and the HIV regimen, the drug, is that it's two injections. It consists of two medications. So instead of just one, you get two injections. And we have a good number here at Midway of patients on it. It's growing daily. And our patients, thank goodness, I'm going to knock on my fake wood desk here, are doing very, very well. We're quite pleased with it. So it's great. It's exciting. Yes.
I do have a question in the comment here. It says if someone was exposed but told after the fact, what needs to be done, and is that person at risk for infection?
I'll let Jen take that one.
Sure. Yeah, so in that instance, that's what we would consider, or we would consider somebody eligible for post-exposure prophylaxis. So let's say you were having sex with somebody and the condom broke, or somebody wasn't using a condom, whatever it may be. And after the fact, somebody shared, oh, by the way, I have HIV, especially if they're not on medication. The goal would be to seek care at an urgent care at places like Midway and other organizations like Midway to get on something called non-occupational post-exposure prophylaxis, aka take some HIV treatment for up to a month and you can prevent getting HIV from that encounter. So yes, the person would be at risk for infection, especially if the person who had HIV was not on medications.
And guys, the information is scrolling at the bottom of the screen. You can find out, you reach out, go on their website, find them, www.midwaycare.org, or you can call them at 561-249-2279. See if PrEP is an option for you. Check out your options. If you feel like you might have been exposed, if you feel like you might have been at risk for something, you were having a freaky night and the condom broke, or you didn't use a condom, or you can't remember if you used a condom because you had a little bit too much to drink, all these are great opportunities for you to go in, get tested, and find out if PEP is right for you, and also if PrEP is right for you as well. And if your results come back reactive, there's so many new options right now for you. So you shouldn't feel as if you can't control this. You can get in care, you can stay in care, you can control it. You can spend it was a if someone is newly diagnosed right now, you can live your entire life as if like
Yeah.
we're not going to pretend like you don't have HIV, but you can live your entire life with HIV, or HIV can live with you, and you can still go back to school, you can still get your education, you can still go after your dreams, your goals, your aspirations, watch your kids grow up and your grandbabies. So don't look, HIV is not a death sentence, okay? Before we jump into another few questions, because time is going. Um, so what you've heard today is HIV, which stands for Human Immunodeficiency Virus, and it's a virus that attacks your immune system and is transmitted sexually or from sharing needles or from mother to child through breastfeeding. Um, and the only way to prevent HIV is, well, there are a couple of ways. One is to be abstinent, right? And we know everybody have a different religious background. So when we say abstinence, we're not talking about abstinence from a religious perspective. We're just saying you just want to be abstinent because that's a personal choice for whatever reason it may be. And that's one way of preventing yourself from getting HIV. Other ways includes using condoms, um, also getting tested with your partners before you have sex with them. Like, I think if you saw our promo on one of our TikTok videos, it says HIV testing is a cute first date. So, absolutely, um, check that out. Sorry, a question just popped in the box. I was like gazing over. Also, we've been talking about STDs. So, if you don't know what STDs are, STDs stand for sexually transmitted diseases, and some of them are infections. So, infections you can cure, diseases you can treat. So, even though you treat them, like for example, syphilis, you can treat syphilis, but every time the doctor does some blood work on you, it will still show up in your system, and that's how they monitor to see if it's coming back or not. And like chlamydia and gonorrhea, you can those are infections; they'll go away, and if they come back, you know that you've been doing something and you got it back again. So it's important for you and your partner to get treatment together if you have an STD or STI. And you also heard PrEP, which is pre exposure prophylaxis. It's a pill you take every day, sort of like the birth control of HIV. You take it every day to prevent HIV. And PEP, post exposure prophylaxis. So if you find out from, you had a date that you were using condoms, a condom break, or you can't remember if you used condoms or not, or someone wasn't truthful about their status, because people do, you can go in, talk to a provider, and get information about how you can get on PEP to basically flood your body with medication to kick it out before it has a chance of latching on to you and latching on to your cells. Um, so uh, I hope you've remembered those terms. And if any time you need more information on those, please definitely reach out to us. You can find us at www.chs.health. Our website is a little bit different, so I'll put that up there. www.chs.health. You can call us if you have questions. We talk to a lot of folks who are newly diagnosed and are living with HIV. So we help them to adjust to their new status. And we talk to family members to help them to reduce stigma and discrimination within families. Because when people are supported and people have a support system in place, they tend to do better. And no, you're not going to get HIV from hugging, from tears, from kissing, eating off the same plate, using the same shower. So stop wasting your bleach. And you're not gonna get HIV from sharing the same clothes, from breathing the same air. That's not how you get HIV or you acquire HIV. You have to be having unprotected sex with a person who is actually HIV positive, or if a mother who is HIV positive is breastfeeding her baby, or if you're sharing needles with someone who is HIV positive, or someone whose status you may not know, but they might have HIV. So those are the only ways that you can really get it. But no, you won't get it from tears, kissing, all of that stuff. So you can hug on your loved ones, you can support them, You can keep them safe. You can keep your family safe and whole. Just always remember that. So we weren't really planning on talking about this, but since I have the experts in the house, and I'm not sure this is going to be like a curveball for them right now. Someone in the comments says, "Please speak about monkeypox." So, do, I know. Listen, so is the what's and guys, listen, we're putting them on the spot right now, okay? So, uh, what basic information we should know about monkeypox, if you're able to speak on that?
So, one of the key things is skin to skin contact. If someone has an active breakout and your skin contacts their skin, then you can more than likely get monkeypox. Right now, they have released more of the vaccines. When this whole thing kind of started, there was a limited amount of vaccines. And so they were only giving vaccinations to those who were actively infected with monkeypox. However, now there are more available. And if somebody deems themselves at risk, they are able to go and get vaccinated. We don't personally have them here in our clinic, but I understand that the health departments have them now. And I'm hearing more and more about the retail pharmacies getting them as well.
Okay, all right. So that's a little spiel on the monkeypox. So Matthew said, "Yes, can we touch on the monkeypox?" Um, so basically, kind of like use some of the same things we did with Corona with COVID, right? We kind of like social distance. We kind of like maintain the safe space. We didn't really did a lot of hugging and all of touching and stuff like that. You don't really know, but I mean, if you are cautious, you know, then that could help. Anything helps. Um, but it's important that if you notice something, no matter, don't just wait for like a bunch of rash to show up. If you notice anything like unusual on your body, like lumps or bumps or whatever you want to call them, pimples, spot, just it's probably best if you talk to your provider. um Schedule a telehealth visit. Absolutely. And then go from there. Because you take that responsibility, and it helps to make sure that everyone is safe, because we have to keep our community safe, y'all. And how we do that is by us all working together collectively. So the more information we have out there, the better. The more information you have, the better. So if you're sitting at home watching this right now and you're like, look, I haven't gotten tested in 6 months, 3 months, but you're like on Grinder, you're out dating, you're out doing a bunch of stuff and not using condoms, you need to, call it Midway right quick and find out what options they got. Okay? So let's talk about your social impacts. And I know at the start of the show, we talked about having everything we do basically come back into this view of like, how do we create social impacts within our communities. And so what are some ways that you are creating social impacts for the communities you serve, for the communities you live in, for the communities you work in and through? Because Palm Beach County is a very big county. um, who would like to go first?
Alisha, you want to go first?
Sure. I will say that prior to working in public health, I really didn't know so much about um, how much it takes a community to pull together to really help the overall well-being for the general population, the community, the good, the overall good of the Palm Beach community. And it really does take a village. Just like we say, it takes a village to raise children. It takes a village of partners, community partners, to come together and really make things work and to contribute to the and well-being of our community. Unless you're personally affected by it, working in public health, or know someone who is impacted, it's amazing. Again, going back to the phrase, you don't know what you don't know, things that are going on in your very own backyard. And so in Palm Beach, it's great that there are different agencies, different organizations that help each other in terms of helping people get access to food, helping people get access to transportation, helping people get access to housing, because it's really hard to worry about your health and well-being if you don't have a roof over your head. And so there are services out there, and just like anywhere, sometimes resources can be a little difficult, but they are out there. And I'm happy to say at Midway, we're fortunate enough to have case managers that have great um, access to some of these services and are able to communicate, even if we don't specifically offer them directly, are able to get in touch with one of the community partners or agencies that do. And so it's good in that sense, because unfortunately, there are people who are in need and don't necessarily know that certain services are available. So, as providers, and Jen will agree with this, we work very closely with community partners and our own case managers to help facilitate access to some of these services.
Okay. Thank you.
Yeah, I agree with you, Alisha. I think one of the things I know that we're both very passionate about is helping to create environments for people to thrive. And so that's just not our staff at Midway. We love doing that with our team there so they can continue to provide care for other people. But also, as Alisha said, our case managers help people to get linked to services that they may need. Maybe it's legal aid. Maybe it is food assistance. Maybe it is housing subsidies. Maybe it is something else. People are made up of so much more than a pill that they take or a diagnosis maybe that they live with. And so we're really big on, again, empowering people and creating environments for people to thrive. We realize healthcare is much more than, again, just a pill or just a diagnosis. It is so much more to that. So we're actively involved in service to the community, and that's through serving on various boards, organizations, trying to work with other organizations, not just through our clinic, but ourselves professionally, in order to give back, to influence and create change, to meet the needs of the people here in Palm Beach County that are here right now. Not the people of 10 years ago, it's the people of today, right? We're grateful for the past, but we've learned a lot. And then my other big area that I'm really passionate about is access to healthcare too. So we talk about the support services, which literally would be nothing. Healthcare really needs the support of the support services like case management and food assistance. But I also serve as faculty. And so I educate and try to help create the next set of healthcare providers that are going to be here even after Alisha and I finish practice one day. And they will be able to continue on with this, to give service to communities, to provide healthcare. And again, just trying to increase access to healthcare is very important too.
That's amazing. Thank you guys for being on the show. Sorry, I'm like all managing stuff behind the scenes here. Thank you guys for being on the show today. We really appreciate you being on, and we're definitely going to have you back on again, hopefully soon. So this way we can continue this conversations. I feel like every time we start having really good, fun information, the time just go swoosh, swoosh, swoosh by. So what that means is that you got to grab the information, guys, right now, right now. So if you want to know if prep is an option for you, the information is right here on the screen, www.midwaycare.org, or call 561-249-2279. They will get you taken care of. They mentioned two locations, one in West Palm and one in
Atlantis.
Atlantis. See? So definitely do and don't worry if you're not, let's say you're not from Palm Beach County and you're in Miami or Orlando or Tampa or someplace, they have locations in those locations too. So you can look on there, find the location that's closest to you, and definitely go in and access services. As you can see, they are chill and laid back, and they're going to be chill and laid back with you. So also remember everything that you discuss with them is confidential. So you don't have to worry about, Ray Ray and them knowing your business down the street. Everything is confidential. They're here to support you and to support you in this process. And we're here to help you to get this information. So go ahead, like, share, subscribe, um, follow. If you have questions after this, and you can't remember the information or you just want some more clarification, please feel free to reach out to us, inbox us, message us, leave a comment, something of the sort, and we'll make sure that you get an answer. As always, thank you for watching. We really appreciate you. Thank you, Alisha. Thank you, Jenn, for being on the show today. We really appreciate you and the work, the amazing work that you're doing, and working to make sure that we all can get towards a generation where we have no new HIV. That day sounds so exciting. um, and I think when that happens, it should be like a big, like, I don't know, parade, something. Like it's just amazing. So thank you guys again for being on the show. Guys, please reach out to them if you have questions. I trust them. So if you trust me, believe me that you can trust them too. All right. Thank you again for watching. Thank you for joining us. Please continue to like, share this with some folks. If they were busy, they're at work or whatever, share it with some folks so they can get this information. We have a responsibility to serve our community, to help our community to be healthy, strong, to grow. And we can't do that if we keep information to ourselves. Take what you need and pass the rest to someone else. Thank you and have a wonderful evening or night.